In today's time, both pollution and population are increasing at an alarming rate, which has led to multiple health issues. The poor among all are the first affected. To improve the quality of health among the poor, educating the poor is the first step. Diseases such as jaundice and diarrhea are caused by consumption of unclean water. The government should ensure that the quality of water supplied in the areas where the poor live is clean and healthy. Since the poor cannot afford expensive medical treatments, free medical checkup camps should be organized for them on a regular basis so that early detection can help in minimizing the risk of disease. Charitable hospitals should also be opened for them. The government should also extend support to the poor for the treatment of life-threatening disease. Globally, providing effective healthcare continues to be an ongoing challenge. In 2017, 10.9 million people in the USA were pushed below the poverty line because of out-of-pocket medical costs. This report revealed that 46% of Americans could not even cover a $400 emergency expense. They would have to cover it by selling something or by borrowing money. Even those Americans who have health insurance often find it difficult to the amount that is required before the insurance plan starts to pay. In this report, it was found that half of all insurance policyholders in the USA faced a deductible of at least $1,000. An amount of $1,000 is already too much for many Americans to have in their bank savings. In 2016, a survey by Go Banking Rates revealed that 34% of Americans have no money in the bank, and 69% of Americans do not even have $1,000 in savings. There is no denying that medical bills are considered to be one of the main reasons of bankruptcies in the US. In England, 500,000 patients had to wait for more than 18 weeks to start planned treatment. In Canada, this study revealed that an estimated 731,000 Canadians had to borrow money to buy prescription drugs. They were also forced to give up their basic necessities. The Commonwealth Fund's 2016 International Health Policy Survey found out that 1 out of 2 Canadians had to wait for 4 or more weeks to see a specialist. India is the top supplier of doctors to the UK and the USA. Since India is the largest provider of generic drugs globally, it is also known as the pharmacy of the world. 25% of all medicines in the UK are sourced from India. 40% of generic drugs taken by Americans are made in India. And India's massive pharmaceutical industry is the source of more than 50% of global demand for various vaccines. With more than 500,000 foreign patients taking treatment annually, India is an important medical tourism destination. The work is still in progress. The vast majority of India's population depends on the country's private healthcare sector, and in most cases, healthcare expenses are paid out of pocket by patients and their families. Out-of-pocket health expenses pushed 55 million Indians into poverty in 2011-12. A survey by NSSO found that 82% of the urban population and 86% of the rural population. However, it is important to point out that 75% of urban households and 68% of rural households in India were able to cover their hospitalization expenditure by their income and savings. The Indian government has been running a campaign that provides medicines at affordable price. Many states in India are running their own state-specific healthcare initiatives, and recently the country has launched an ambitious nationwide scheme, which is said to be the world's biggest government health program. If implemented properly, this scheme would be a game changer for the poor. In July 2018, India Supreme Court said that the private hospitals in Delhi, which are allowed to buy land at a concessional rate, various religious and dharmic organizations in India are running hospitals too. In India, not-for-profit organizations are spread in both urban and rural areas. Free treatment was available to those who had a BPL card. Encouraged by the Indian tradition of Seva and driven by mission to provide healthcare service to the poor and deprived people. The hospital has been providing all diagnostic specialties and major treatment, which also includes cardiac surgery and chemotherapy. In the cancer unit, around 150 patients are attended to or treated every day. According to the hospital authorities, 90% of cancer patients are given free treatment. The hospital never denies treatment to anybody on financial grounds. Traditional Indian practices like Ayurveda and Yoga strongly focus on mental and physical well-being, and they are deeply rooted in the concept of preventive health care. Ayurvedic medicines and treatments are extremely popular and are readily available in the country. The challenges are complex, and India's healthcare system is multi-layered. Providing top-quality healthcare and, more importantly, encouraging citizens to practice a healthy lifestyle are mandatory duties for any government. Will India succeed in its mission?